Hello and welcome to the Mindful Medics podcast. Welcome to another episode. And today I'm delighted to welcome Dr. Paul DeChant, who advises C-level healthcare executives on managing critical problems such as financial and staffing challenges by addressing the root causes of clinical burnout. Following a 25-year history of practicing medicine in settings as varied as San Francisco, Breckenridge in Colorado, and the Gainzinger Health in central Pennsylvania, he became the CEO of the Suter Gould Medical Foundation, where he led a transformation that achieved recognition for the group as the highest performing among 170 medical groups across the state of California 2 years in a row, while improving physician satisfaction from the 45th to the 87th centile on the AMGA's Provider Satisfaction Survey. He received his MD from the Oregon Health Sciences University and his MBA from the University of Colorado, Denver. He co-authored the book Preventing Physician Burnout, Curing the Chaos and Returning Joy to the Practice of Medicine. Paul speaks internationally and blogs regularly. So welcome to the podcast.
Thank you, Leonaura. I'm so happy to be here.
Excellent. So, Paul, I have some questions for you today. Tell us a little bit about how you decided to become a doctor in the first place and what led you down your career trajectory.
I'm not quite sure why I decided to become a doctor. Nobody in my family was medical. It was something I was always interested in science and interested in people, kind of the typical story you often hear. But once I got into medical school and, went through my career, I just went deeper with that, really, enjoying the ability to take care of people, the satisfaction of when patients were grateful for the work that I'd done, the scientific satisfaction of figuring things out that otherwise wouldn't be, and some opportunity for adventure. This is a career that we can transport if we choose to other locations. So while I was in med school, I spent 3 months in Liberia in a little mission hospital. This was back in 1979, way before, any of the Ebola or any of the revolutions that happened in Liberia. And I've been able to do some other overseas work from time to time, as well as work in different places, from suburbia to mountain resorts, and just have, a variety of great experiences throughout all of that.
Wonderful. And what made you transition into more of a management, leadership, preventing physician burnout type of role?
When things went wrong in my office, I wanted the autonomy to fix those things, and I would speak up. And I think just because I was speaking up, people put me on committees, and then I chaired committees and became a medical director. I just kind of progressively took on a little more each couple of years along the way, looking for ways that I could help make things better, fix things, that sort of thing. And so as I did that, there were so many things that needed fixing, even before the EHR and certainly after the EHR got into place. And I was one of those people that could see the opportunities. I could help activate and make change start to happen. And those really, they excited me, and I found it very fulfilling to not just fix things for myself, but to try to make things better for my colleagues, for our support staff, and for our patients.
I love that. So it seems like you have a natural leadership ability and a very strong desire to solve problems as well. And I think, a lot of medical professions, it's funny, I was talking to a couple who are doctors recently, and they were saying that they didn't have an entrepreneurial bone in their bodies. They had these were doctors from the UK, and they had gone into medicine, and they realized they'd had their whole career of just kind of doing what they were told and not questioning everything. And it sounds like you, a little bit like me, have more of a kind of individualistic mentality and a drive to to look deeper for the problems and to solve them rather than just being resigned to accepting them.
It's interesting because I think a lot of our medical education actually beats that entrepreneurism out of us. 20, 30, certainly 30 or 40 years ago, most physicians, at least in the US, were autonomous. They had their own practice. They ran it themselves. And there's something about medical education as healthcare got more complicated that it makes us think that we can't be more, we can't have more independence than we actually do. We feel like we almost have to be employees because everything is so difficult and complex and challenging. And it's starting to seem that that's not quite so true. I think the other thing for me, I realized I do have this bent towards leadership, but I also I've struggled with this concept of what right I have to, if you're a leader, to tell other people what to do. As a physician, I've gone through the same training that all of my colleagues have. They face all the same challenges. Why should I be somebody telling them what to do? So I've really tried to think of my leadership not as telling people what to do or managing them or directing them, as much as setting up the situations where they can be empowered to fix the problems that they're dealing with. One of the challenges that came with that was once I became the CEO of this 300 physician group, while I had wanted that empowerment as a family doctor to fix things that I was worried about, the thought of all 300 doctors independently, autonomously empowered scared me. We'd fall apart from entropy. And so, and yet micromanaging, we knew wouldn't work. So we found a way to give local autonomy to fix those local problems in somebody's office or the OR or the ER, but at the same time, help align everybody around success for the overall enterprise, which is absolutely vital as well.
I love that. I often say to my coaching clients, your role as a leader is, number one, to do your job well, which goes without saying. And secondly, to create an environment in which everybody else can thrive. And and I always say as well, the thriving is on them, because it's a big responsibility on a leader, for everybody else's well-being. But if you can create the environment in which there is the potential for people to thrive, then that is all you can do as a leader. So I love what you're saying, and it sounds like you did an amazing job of leading 300 physicians. I can't even begin to imagine how difficult that is.
And those groups are even getting larger nowadays. I mean, that was 10, 12 years ago. Nowadays, it's even, that's a moderate sized group at best, as more groups are consolidating. Your point about creating the conditions, I think, is so important. I really love what you said there. And on one hand, you think, well, it shouldn't be that hard to just give people the opportunity to thrive. And yet, on the other hand, in these leadership positions, oftentimes now, even if you're CEO of a 300 physician group, there's at least one or two levels of people above you in a health system that are expecting a certain level of performance and achievement, and oftentimes striving for those results to happen pretty quickly. So it helps create this pressure on you as a leader. And so that can be a real challenge. Plus, we've come from a lot of our original sort of formative leadership training happened not intentionally, but during medical school and residency, on things like rounds, where you're going around, your superiors are expecting you to know more than maybe humanly possible to know. That term, forgive the language, but getting pimped on rounds. Every doctor understands that term, and it's not it's the opposite of a psychologically safe environment. Yeah. Where generally people can thrive and are willing to experiment, are willing to put forward new ideas, or even to point out a potential problem. And without that kind of environment in place, organizations, certainly individuals, are at much higher risk of burnout, and the organization is at much higher risk of failure. Mm-hmm. And to be able to create that environment is so important. And yet, in many ways, there's a lot of forces working against our ability to do that. Yeah,
absolutely. Oh my goodness, I love all of this. So tell me, I was going to ask you, what's one piece of advice that you wish you'd received when you were starting your medical career? But I guess there's, that then translates into, and what advice would you give to people starting out in their medical career today?
Yeah. There's so many things I wish I had known and thought about doing differently in my career.
Sure.
One of the bigger ones is learning, being really aware of what I do and say and how that impacts multiple people in an organization, because we are, for the most part, in these complex organizations. And while I could see something needed to get done, how I would present that, how I would go about that, and how I would make sure that the person I was reporting up to understood what I was doing and would support it. The people who were my peers, other people reporting up to that same person, that they understood what I was doing and I understood what they were doing, so I could help them with what they were doing. And then the people who are reporting up to me, that I understand where they're at and that they understand what we're trying to do collectively as a team. That kind of listening and understanding and really getting that feel as you're introducing change is key. It's impossible to not be dealing with change these days, but to drive change effectively, that awareness is so important. I made a major mistake earlier in my career when a group of nurses in one of the complex organizations I was in decided that they were going to change the way that we roomed patients, that every single patient who was going to get roomed was going to be asked 8 different questions about their past and their safety and all of these things. And they were valid questions, but if they were asked every single time a patient got roomed, it would grind the clinics to a halt. And in the meeting where they presented this, I was used to getting, that old, challenged and strongly on rounds or in other situations. And I challenged them pretty strongly, and it came back to bite me. The people felt like I had been offensive. I even had to talk to HR. And it was a real lesson in stopping a second, thinking very carefully. Oftentimes we are smart. We know, many times we see stuff that's stupid. We know what the right thing to do is. And just being much more political about how I approached significant change would have served me much better. I would have gotten most likely to the same places, maybe further. And, and just that urgency to fix things would sometimes drive me to be a little more assertive than that I probably should have been.
Yes, I love that insight. And I think, people in the medical profession are usually extremely bright and, well educated, but maybe lacking in empathy towards other people. I do remember when I was doing obstetrics and I was delivering babies. I remember sometimes thinking, oh my goodness, what's wrong with these women? Why are they making such a fuss? I then went on to have 2 children and completely understood about it. But, as doctors, we are not often, we're not trained in how to be empathic to our patients or our colleagues. It maybe doesn't come naturally to all of us. It certainly didn't to me. I was a nice person, but I struggle with that. And also being able to, put yourself in somebody else's shoes and communicate with them, not in the way that you would want to be communicated to, but in the way that they would be receptive to. And that's a little bit of an art that I don't know if it's taught in medical school now, but it certainly wasn't when I was, 30 years ago when I qualified.
Yeah, I think there's huge variation in how well that is taught from program to program, even, department to department. Yeah. One of the things that struck me deeply when I moved from my CEO role, I left there probably about 10 years ago and went to work with a consulting firm, actually the consulting firm that helped me to lead the transformation I did when I was CEO. Yeah. They were a lean consulting firm, and they sent me to this conference called the Association for Manufacturing Excellence. And it's very lean oriented. And I thought, what am I? I'm a doctor. What am I going to learn from these people that make garage doors and widgets? Why am I bothering to go to this place? Yeah. And I came away embarrassed for healthcare because I attended a panel of 5 CEOs who were in manufacturing. I mean, in fact, one of the more famous people who led this is a guy named Bob Chapman, runs a company called Barry Waymiller, and he's written a book called Everybody Matters, The Incredible Power of Treating Your People Like Family. And he presented how in this company that's making bottle washers for Budweiser and things like that, they had created a culture where everybody cared about each other. And so internally, people really got along well. Things were very positive. They all supported each other. There may not have been deep purpose and meaning like we have in healthcare. We have, we're here to take care of patients. We've got deep purpose. Now, that's not a question. But they may not have had that same purpose in the actual work being done, but in caring for each other, they did. And I realized, while we have this in caring for the patients is a deep sense of purpose for us, caring for each other is almost in some ways the opposite in healthcare. We're often very harsh on each other. People, whether it's the experience we'd have on rounds or the term about nurses eating their young, it's this culture where we have high expectations. We're concerned that we might make a mistake that could damage a patient. So that intensity to not make a mistake and the pressure on people to not do that ends up in these behaviors that are not conducive to really being mutually supportive. And yet without that mutual support, we're actually more likely to cause problems.
Absolutely. And that brings me to the next question I was going to ask you, which is about managing stress. And another thing that I don't know about you, I wasn't taught when I was, a young doctor, how to manage stress. I look back and I had virtually no tools at all then. So I'm curious, how did you deal with stress when you were a young doctor, and also as you kind of rose through the ranks and became a leader?
Not always very well. I have two things I would do. One was meditation. I actually learned meditation in college, and I done it variably throughout my career. It's not something I looking back again, I wish I would have done it much more regularly. Absolutely. And exercise. I really got into running, just not competitively, just for the pleasure of it, the relaxation of it, clearing my head, all of that. So those are really the two ways that I would manage it. Or at least the healthiest ways that I would manage it. I think it's so important to have that perspective, to realize that, and to make that effort. I do think there's more awareness today than there was 20, 30, 40 years ago. And that's really great that there needs to be. Yeah,
absolutely. So what led you to write your book for medical practitioners?
Having gone through all the experiences I had up through being the CEO, and then I joined this consulting firm, they actually encouraged me to write the book because they could see too that the work that was done, it's interesting, I'm a real advocate of lean, both lean management and lean process redesign. And most people hear lean and they think either, we tried that, it didn't work, or, lean is all about reducing, making things more efficient and doing more with less people, and people are going to get laid off. And in fact, it's that's lean as a misappropriately executed, or the acronym would be LAME. But the real lean starts with the first principle of respect for people, recognizing that everybody in their job, pretty much these days, is a knowledge worker who has to make decisions on the fly, has to be able to innovate all day long, knows what's challenging and broken in their work process, and often has great ideas about how to fix it, but we rarely get the opportunity to do so. And then when we put that into place and treat people with that respect, give them those opportunities, that's when we actually start to make the continuous improvement changes, start to create the efficiencies that we're looking for, and actually achieve great things in the process. That ability to understand the deep root causes of burnout and then express how to address them with specific activities was something that we hadn't seen written anywhere before. One of the opportunities I got was to actually get to know Christina Masloch personally, and reading her work and all the specifics around burnout, with the 3 dimensions of exhaustion, cynicism, and inefficacy. And then more importantly, the drivers of burnout, which are work overload, which she showed drives exhaustion. And, that there's so many ways that our workflows were inefficient. We're trying to do more work than it's possible to do unless we redesign the work to create the efficiency. And actually, I do believe that these days we have the opportunity to tremendously improve efficiency and actually reduce work burden. But more than that, there's 5 other drivers of burnout that drive the cynicism component and have all to do with leadership. And those are a lack of control, insufficient recognition and reward, breakdown of community and connection with each other, absence of fairness in the way someone is treated on a team, and lastly, values conflicts. And we can lead, and whether we're leading a team as small as 2 or 3 people or as large as a health system with 20 or 30,000 employees in it, if you lead in ways that exacerbate those drivers, you drive cynicism. And if you lead in ways that mitigate those drivers through giving people empowerment and aligning them around the values that bring meaning to the work, we can create so much amazing engagement. And that's where the real power of improvement comes from.
I love that. Wonderful. And just remind us of the title of your book, Paul.
The title is Preventing Physician Burnout, Curing the Chaos, and Returning Joy to Patient Care. It really, the other thing that drove us to write it was that 10 years ago, when I started going to burnout conferences, 90% of the discussions were about enhancing personal resilience. And very little discussion actually about fixing the things that were causing the need for that resilience, all of the inefficiencies and cultural issues. And now it's actually quite good to see that really has begun to change significantly. And there's a lot more focus on improving practice efficiency and a lot more focus on, more focus, but still more need, particularly around leadership and culture changes in healthcare.
Yeah. I've got an image in my head of the story about the person who's at the mouth of a river and they see somebody coming by drowning and they jump in and rescue them, and then somebody else comes in and they jump in and rescue them, and suddenly there's like 20 people in the water, and they're jumping in and getting exhausted, and then somebody passes by and says, "Well, let's go upstream and see who's throwing the people in the water." And that's that's what we're talking about here.
Yeah,
how do
exactly.
and I think both are necessary. You also need to learn how to be more resilient and manage stress, but there's also a big component of how do we prevent it in the first place as much as is humanly possible, because let's face it, the world is stressful, and being a doctor, a medical profession is also super stressful, no matter what you do.
Yeah.
So the two.
Oh, it's true. On the personal resilience note, there's 2 things I think that are really important to understand there. One is that self-care is not selfish. Oftentimes we go into this profession because we want to care for others. And when there's so much to learn and so much work to do, we think that if we're taking time to care for ourselves, we're somehow not doing the important thing, which is caring for others. And yet you can't be effective if you haven't taken care of yourself. So self-care is not selfish. And then secondly, that self-care is absolutely vital because things are so challenging, but it's also completely insufficient if we want to solve the problem.
Indeed, absolutely. I look back. My years, I did 3 years of hospital medicine, and it was all a bit of a blur, to be honest. It was, I was working, and my first job was over 100 hours a week on average. And, there was, I don't think I even knew what self-care for me was a chocolate bar in each pocket when I kind of went on a shift. That was as good as it got. And, I'm so grateful to people like you for, doing the research on this and writing books and supporting physicians, because these are good people who we need to stay in the profession. Like, we need people to be carers and healers. And, if we allow them all to burn out, then very quickly, the whole medical system falls apart, and we are all going to suffer. So, so thank you. Thank you for what you do.
Well, thank you. I think the most important thing to fix these complex systems that's not being addressed adequately is leadership. Is particularly at the senior leadership level, that oftentimes the senior leaders are so far removed because they're overwhelmed that they're not aware of the actual operational challenges at the front lines. Yes. And carving out time to connect to people on the front lines, not just wandering around and asking them how things are going, but actually observing, actually getting involved, even kind of doing the work side by side with them as much as they can with their competencies. It's so vital to then be able to make better decisions because they're better informed about what the real challenges are for the work that's being done. We really encourage senior leaders to actually shadow clinicians while they're working, just like med students shadow and attending. Just follow them around and see what happens. And they realize when the computer's taking a long time to open, or the passwords have just changed and you can't get in, or you can't find a wheelchair to save your soul, that there are these operational things that are making it hard for fantastic doctors and nurses to do the job, and burning them out, and actually improve opportunities to improve efficiency and improve the financial status of the hospital as well.
Yeah. I'm reminded when I worked in the National Health Service in the UK, we had healthcare managers who were not medical professionals. And what I did love about that program was that they had to work in every single department in the hospital. They had to push gurneys up the corridors to, into the OR. They had to, be in almost every department of the hospital. And they had to do a week in each department before they were allowed to manage. And this was like 25 years ago. I was so impressed by that. It was such a brilliant idea.
Absolutely. Yeah, my first job in healthcare, I was an orderly in the operating room. And so I would transport patients up to the OR. I'd mop floors in between cases. I'd hold up legs while they were getting prepped, help clean instruments, all those different things. I loved it, actually. And it was a good way to get a solid sense of what all was going on and the work it takes to deliver care.
Absolutely. I love that. So tell me, Paul, based off your career in medicine, what are 3 pieces of advice you wish medical professionals, the general population, knew about how to stay healthy and live their best life?
Well, I mentioned that I worked as a surgical orderly. I loved the operating room atmosphere, but I went into family medicine because I wanted to do preventive work. I thought, a lot of what I saw happen in the OR was fixing up past mistakes. So, certainly to stay healthy, the usual things people talk about: eating carefully, not smoking, getting regular exercise, limiting alcohol. All those things are really key. Beyond that, I think being cognizant of how you're doing personally, whether it's for the clinicians or for the patients, that awareness, it's, in our high pressure society with so many stresses and strains now, maintaining that awareness is important, but incredibly challenging.
Yeah, absolutely. It's a hard balance to get right, isn't it?
Yeah.
So tell me, Paul, is there anything that you're working on right now that we haven't already discussed that you would like the audience to know about?
Right now I'm trying to focus my attention on leaders, on people in leadership positions, to help them understand how to lead in this way that does empower people on the front lines and align everyone around the enterprise-wide success. Because there's just way too much micromanagement in healthcare. And I don't fault the people who are managing in that way, because they learned their management from the people as they moved up the ranks. They got promoted by somebody who had moved up the ranks before them, but almost all of them had come from that older style, I call it industrial style management, where basically people are being told what to do. And now we're we've moved away from the industrial age. We're in the information age, and that industrial style management just doesn't work. People are knowledge worker. Even someone checking some patients in at a front desk has to be a knowledge worker where they know an awful lot about what they're doing. They have to innovate all day long with every single patient they work with. And it's very hard for their managers to actually do their job. They need that autonomy, that innovation ability to do their job well. But learning to lead in that way, particularly to lead complex organizations, is a real challenge. So that's where I'm trying to focus it. And if there's any leaders out there that are listening to this, that are wondering what they could do differently that could make their day go better and their organization do better, gosh, just feel free to reach out to me. I would love to talk to anyone who's interested in that.
Wonderful. And if I could also recommend you on social media, Paul, because you have a wonderful TikTok channel where you share, is it daily you post? You do a lot of posting.
Pretty much daily, yeah.
With some amazing tips on leadership, and I look forward to you showing up in my feed every day, and you're also on Instagram. So I'd recommend anybody who's interested in leadership in any form, whether it be in medicine or another field, to check out Dr. Paul on on the various social media channels.
Yeah, the TikTok's interesting. I started it about 6-7 months ago. I never thought I'd be on TikTok of all places, but once you get in there, you realize there are many physicians, many nurses, many people in leadership that are on TikTok, and it's a great place to communicate, to learn from others. It's been a pleasure seeing you there as well.
Thank you. I was talking to my sister-in-law this morning, who's a teacher, and she has, many, many years of experience, and she's extremely wise, and she's been thinking about starting a YouTube channel. And I said to her, you just never know who out there is going to benefit from your wisdom. And we have to come from that kind of viewpoint that, if we put it generously, our knowledge generously out into the world, that maybe we can make the world a better place, even if it's just for one person. So that's kind of my attitude. So, a lot of people are like, I'm not going to do social media, it's icky, etc. But, if you can make one person's life better, then I would suggest it was worth it.
Yeah. Indeed.
So thank you, Dr. Paul DeChant, for being on the show today. It has been an absolute pleasure. We could probably talk all day, but thank you for your time. And please, everybody do go and check out Dr. Paul on all of the channels, and his links are going to be in the show notes below. So thank you all for joining this episode of the Mindful Medics podcast. It has been my pleasure to host it today, and I look forward to seeing you on the next show. And I wish you all much health, happiness, and abundance. Bye for now. See you next time.